Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. In this particular today's video, we are discussing those questions which came in our Norcet 8 mains exams with the exact question body and a perfect four options and what is the exact correct answer with the rationally clarity, how the concept are coming in your exam, and especially it's very important to those candidates who are preparing for the Norcet 9 to know what was the level of the paper, how actually questions are coming, so what kind of the questions are coming, from where the questions are coming. So these clarity if you people having in your mind before your Norcet 9 exam means, so that is much helpful to create a base to you people to take a better step towards your study in the Norcet 9 exams. Students, in the last previous class of the question discussion of the Norcet means, where I have discussed all those very important questions which came in your Norcet 8 mains exams with a proof from where the questions came, like from the master nursing classes, a crash course session with the proof I have shown to you people. And in the prelims exams as well, I have shown the questions with proof from where the concept are coming, from where the questions are coming, right? In this today's video, my purpose is not to prove myself in this video. So here I am here to clear the mindset of the aspirants that which level of the questions are coming and how you have to tag that questions, how we have to choose the correct options to get the better rank, right? So already a result everything is announced, still we are discussing the paper. The purpose is to clear your mindset, to motivate you, to boost you, to push you one more step near to your selection. That's it, right? So who all are got the good rank again, once again the congratulations, and who all are didn't get the good ranks. So from my side one word, that is it's an one more chance for you people to prove yourself. So prepare very hard, prepare very nicely, and your bounce back story should be a great history in future, right? So we'll start the today's session with this particular very important motivational quote. And here is the first question for you people. So please do read the question carefully, completely till the end, and give your best answer in the comment box, right? Very good evening, beta. Very good evening. So please do hit the like button, everyone. And if anyone of you are watching the master nursing classes, the way of success in first time means, so please do hit the subscribe button. And who all are live to the session, so please hit the like button as well. All right. So we'll start the question discussion now. A newborn presents with the abdominal distension and a failure to pass the meconium since 48 hours after the birth. It's a clarity, direct strike question from the our test series. At least 3 times practice we have given to you people, right? So that is the a newborn is there, means just the baby is born. Okay, so now the abdomen of the baby is completely distended because of the megacolon. Okay, because of the excessive accumulation of the feces in the colon of the baby. Okay, so that become the colon become bigger here. So the abdomen is got distended and the baby is not passing the stool because, as I told, the feces is accumulating in the intestine only. So because of the absence of the ganglionic cells in the intestine, right? So this history, if the examiner is throwing in front of you, means you should have the clarity in mind. A newborn with abdominal distension and who is a failure to pass the meconium after the first 48 hours after birth. So he was born at term, normal vaginal delivery only, and no any complications were there. On examination, abdomen is distended, yes, because of the accumulation of the fetus. And when we insert the rectal, when we go for the rectal examination, suddenly excessive accumulated fluid we explosively releases out. Okay, so what is the actual diagnosis? It's a clear diagnosis of the our, yes, the Hirschsprung's disease, or we can say the ganglionic megacolon. Okay, so what is the another name of the Hirschsprung's disease? It's an aganglionic megacolon. What it means? A means absent. Ganglionic means the ganglionic neuronal cells of the intestine. So here the absent of the ganglionic cells. Okay. So then because of that, there is no movement in the bowel. So the feces will accumulate in the bowel and bowel becomes bigger in size. So that is what we call the, because of the absence of the ganglionic cells, the colon become bigger. So we call that one as in the ganglionic megacolon. Okay. So what is the diagnosis of choice? The most repeatedly asked question, that is the rectal biopsy we have to take, and we have to check for the ganglionic cells are there or not in the colon biopsy, right? So that is the rectal biopsy is the diagnosis of the choice. Very, very important. Okay. So hope the concept and question is clear to you people. And here is the next very important question from this psychiatry. Okay. So almost discussed the question. 30-year-old man is brought to the psychiatric clinic by his family, and he claims that a secret government agency has implanted a chip in his brain. Okay. So what is the issue here? A case of the psychiatric patient who is brought to the clinic, and now the patient is telling a secret government agency. Okay. So they placed a chip in the patient brain, and they are monitoring the his thoughts, and they are controlling his actions. So the patient is manifesting these particular things. So what is the most likely the symptom of the patient is experiencing here? So your clear answer goes to the, that is the delusion. Okay. It's not hallucination, it's not a illusion, it's not a flight of idea, it's a false fixed belief. Okay. So it's a false fixed belief that the patient is having here. The some government agency have inserted some chip in his mind, and so they are controlling his actions, and they are controlling his, yes, the thoughts the patient is complaining. It is the patient's false fixed belief. Okay. So it's nothing but that. So the answer goes here as the delusion, right? So have a clarity in your mind related to the questions. So what kind of the questions are coming is, so how many times we have discussed the delusion? The repeatedly the questions is coming from the specified thing that is made for your exams, right? Yes, we are here to discuss those things. Don't have to worry about that, right? So the next question is, which tool is a screening instrument developed for the or to detect the alcohol related problems? So that is the cage questionnaires are the tool which is which is developed to discuss the alcohol related problems. Here it's a screening tool. Okay. So what is the case here? So we will ask the patient four questions. Here the cage questionnaires we can say to screen the alcohol patients. So we will use these questionnaires tools. So C stands here. We will ask the patient whether have you ever felt you should cut down your drinking. So C stands here the cut down. Okay. So have you ever felt, like we will ask the patient, आपको कभी लगा है क्या आपको शराब छोड़ना है, like, so we will ask to the patient. Okay. So that is, have you ever felt that you want to cut down your drinking? So we'll ask here. So C stands here as the that thing, and here A stands here as the, have people annoyed you by criticizing your drinking? Have people anytime they have avoided you, they have neglected you, how they have disrespected you because of your drinking? So we'll ask the question. So the A stands here, that is annoyed. Okay. So then the G stands here as the, have you ever felt guilty about your drinking? We'll ask to the patient. G stands here as the guilty. Okay. So then the next E stands here as, have you ever a eye opener? Okay. So have you ever a morning drinker? Okay. So you will ask that. So have you ever had a drink first thing in the morning, and to study your nerves and to get rid of the hangover? Okay. So you'll ask like this. So just a thing E here is the eye opener. Okay. We will ask the patient, have you ever had a like morning drinking? Some people they will start their day with the drinking only. Okay. So then G stands here as the, have you ever felt guilty about your drinking? And A stands for, have you ever annoyed about your drinking? And C stands here, we will ask the patient, have you ever felt or have you ever thought that you want to cut down your drinking? We'll ask. So this is the cage questionnaires. Okay. So there are total like many questions from the alcohol dependence. So this is the primary important questions which was asked in your exams. Okay. Related to the cage questionnaires. Okay. So in the alcohol dependence problem, right? So this was the direct questions with the same image बच्चों, related to the atrial fibrillation, two questions I have discussed, one image I have shown. So very importantly, the image came in your exam. Just open the ECG class in the YouTube. See, in the two classes, there are total 4 to 5 questions. Like in the prelims, 3 questions, and in the mains, 2 questions. In the two classes, 5 questions you are getting. What else you want? So that is the specialty of the master nursing classes. Okay, the same questions with the same image which came in your exam related to the atrial fibrillation. So this is the image of the atrial fibrillation. The rest all entire important things, questions, concept, and images of the ECG discussed already in the YouTube channel. The link is I will provide in the comment box. If you want to complete details about ECG, so please do watch the videos, right? So here is the next very important question in front of you people. So that is, which of the following features best distinguish a delirium and dementia? There are total 2 questions on the delirium and dementia differentiation. One is related to the level of the consciousness fluctuation, and one is related to acute and chronic conditions. Okay, we'll discuss both questions, so don't worry. So, which of the following features that distinguish or differentiate between the delirium from a dementia? Okay, so the thing you people have to remember here is, so in the delirium, look at the spellings. There are two eyes will come. Okay, two eyes will be there. So all you people have to remember here is the IC. What it means, sir? In the delirium, the consciousness also decreasing, and the cognitive functions also decreasing. Remember, one more time I am telling, in the delirium, the consciousness also will decrease and the cognitive function also will get decreased. But in the dementia, the cognitive functions only will get decreased. Okay, there is no any fluctuation or there is no any changes in the level of the consciousness. Remember, again I am repeating the statement, in the dementia there is no any changes in the level of the consciousness, only cognitive functions related to the memory, related to the thinking, related to the calculation. Okay, so those abilities will get decreases in the dementia. Okay, there is no any changes or fluctuation in the level of the consciousness. Okay, so the delirium is differentiated with respect to dementia by fluctuating the level of the consciousness. So this is the actual answer what you people used to choose in your exam. Okay, this is the correct answer here. Okay, so hope the trick is helpful to you people here. Okay, so and a special announcement, who all are preparing for the Norcet 9 exams. Norcet 9 exams. So searching for a wonderful content, updated content, questions on the clinical based, scenario based, practical based questions, everything what you want under one roof related to the test series. Here is the India's best test series app, that is the Master Nursing Class app, where you are getting the these all facilities under a very affordable prices, right? So the thing what you will get here is the Norcet 9 Mega Test Series, Navagraha Mega Test Series. Here in this one, you are getting a daily live exam. Okay, so the live exam started morning 6 a.m. and it will end at the 11 p.m. and you will get the All India rank at the 11:30 p.m. daily. Okay, so after that, if you are unable to attend the live exam, means so what can I do, sir? Yes, don't have to worry. That paper, same paper, we will upload in the multiple attempt section. In the next day, you can attempt that one. No problem. Okay, sir, whether we can able to attend anytime 6 a.m. to 11 p.m. Yes, since from the morning 6 a.m. to 11 p.m. in between, wherever you will get time of the 1.5 hour, so you can use that one completely and you can attempt the question paper anytime between the morning 6 a.m. to 11 p.m. Okay, so then a extra practice paper you will get here, like mains patterns and prelims patterns question papers, then a weekly booster class which including the very important multiple choice questions, updated questions, content. Okay, so concept based questions, practice based questions, practical based questions, everything we will discuss here in this weekly booster class. So it is a one class per week. Okay, so that includes a very important updated things that is much necessary for your Norcet 9 exams, right? So then there is 24 into 7 a chat box support where we will solve a doubt which you have created during the test series attempt. Okay, if you have any doubts related to any questions from the any test series of the master nursing classes, you can text in the chat support box which is there in the app. So we will respond immediately to your questions, queries, and doubts, right? So there is doubt clearance session by the chat support. Okay, then validity of the test will be for the 7 month. Okay, so it means you will get the a live test till the Norcet 8 mains exams. Okay, and you can access the courses till the 7 month, right? So that is the very very important thing for you people. So who are preparing for the Norcet 9, use this a great opportunity to update your ranks. Okay, so practicing the quality contents always gives you a best result, right? So here is the next question: which of the following describes the again a delirium compared to the dementia? Just previously we have discussed that in the delirium there is level of consciousness will be altered, and in the dementia there is no any level of the consciousness will be changes. Okay, so and the two questions I told, which came from the differentiation between the delirium and dementia, that one was the previous question, and here is the second question. Here, the questions are telling that the statements in the options, option A is delirium has a gradual onset, while dementia has an acute onset. It's an opposite statement. Bacho, a delirium is an acute onset or the sudden onset. So we call the delirium as an acute organic mental disorder. Yes, what we can say, that is acute organic mental disorders. In the organic mental disorders, we are having the two disorders. That is the dementia and delirium. In that one, the delirium is a acute condition and the dementia is in the chronic condition or the gradual onset. We can say the statement of the option B is the perfect answer. So who all are chosen this one as a correct answer, and you people are there in the rank list. Okay, so this is the image based question IBQ asked in your exam. This is the bubble CPAP. Okay, what it is? It is an bubble CPAP. Okay, continuous positive area pressure. So this is the bubble CPAP question. Okay, so then this was the question, image based question again asked in your exams. This is the Haberman feeder. So this is used primarily to feed baby with cleft lip and palate. Okay, so we are using this one, that's the Haberman feeder. So here we'll be having the long nipples. So by using this one, we can avoid the palated part and we can directly feed by the posterior pharynx. Okay, by using this one. So that is the Haberman feeders. So used to feed the baby with the cleft lip and cleft palate surgeries or conditions, right? So hope two questions are clear, and one more image based question. Same question which is came in your exams, that is the erythema toxicum neonatum was the answer for this one. So this is a normal conditions we can say in the seen in the babies. So that is the erythema toxicum neonatum, right? So this was the question asked in your exams, right? And yes, this is the atrial fibrillation related question already just now we discussed. So this is the same question which was asked in the exams. Okay, where the Nagaraj sir told you already, right? So then these kind of the 3 to 4 questions were there to match the columns. Okay, so 2 questions from the OBG, 2 questions from the community, and 1 questions from the like psychiatry. It was, I think so. So the match the following questions in the last 3 Norcet there was no any match the following questions. Okay, so in the Norcet 7 only 1 questions were there, but in the Norcet 8 the 6 to 8 questions are there to match. To go for the match the following questions, like, okay, so here the very simple thing, all you people have to match the this column A with the column B. Okay, what is the Hagar sign? Hagar sign is the, yes, the very simple, that's the, yes, the, what we can say the Hagar sign is, option is the softening of the cervix. So what you can say the softening of the cervix is the good and soft cervix, that is the Godal sign, right? The softening of the cervix is the Godal sign. Then comes to the Second statement, the softening of the lower uterine segments, that is the isthmus. The softening of the isthmus is the Hagar sign, right? Then the Chadwick sign, CH. CH is the CH, that is the change in the color of the vaginal mucosa to bluish discoloration. Okay, so Chadwick sign is the bluish discoloration of the vaginal mucosa. Then Ballotment is the Ballotment is the, so we can, here we will assess clinically whether the baby's head is engaged or not. Okay, if not engaged, we can say the palatable head. If engaged, so we can say non-palatable head. Okay, so that is a rebounding of the fetus when they tapped vaginally. Okay, if it's tapped vaginally, so it will rebound. Okay, so that is the ballotment, right? So here just compare the things. A2. Okay, search A2 here. Only option A is the A2. So rest all thing you can eliminate directly. Okay, still you have to confirm. So that is the B1. Okay, here's the B1. Then the C3. Yes, the C3 and D4. D4. Okay, so right. So here is the correct answer for this one. Right. So here is the next question. Very important question. Wide pulse pressure seen with. Already discussed question, most important question. So we have discussed all the concept related to the wide pulse pressure and narrow pulse pressure, where I told to you people by giving the examples of the cardiac tamponade, Cushing syndromes, where the systolic hypertension we will see in the Cushing syndrome, Cushing triad of the raised ICP. In the raised ICP, in the Cushing triad, where we will see the increased systolic blood pressure with the widened pulse pressure. So those are all examples I have given, but the questions was diverted towards the congenital heart diseases. Okay, so here the wide pulse pressure will be seen. Yes, here is the answer goes to the patent ductus arteriosus. How sir? Why sir? The question is how sir? Why sir? Yes, in the patent ductus arteriosus. So what it means actually? This is the heart you consider. Okay, so here is the pulmonary artery and here is the aorta. Okay, so here is the connection between the pulmonary artery and aorta in intrauterine life. If it is remaining in the extrauterine life actively, okay, so we can say that is the patent ductus arteriosus. Okay, normally there is ductus arteriosus connection between there between the pulmonary artery and aorta in the intrauterine life. Okay, after the birth it will closes. So if it is not closing means we can say the patent ductus arteriosus. Okay, so here when the aortic blood suddenly comes to the side, so the diastolic blood pressure will get suddenly decreases here because the peripheral vascular resistance seems to be a very low. Okay, so it is actually a normal peripheral vascular resistance, but due to the extra opening the blood is diverting and heart feels it is on the very low peripheral vascular resistance, and actually diastolic blood pressure will get decreases suddenly. So here the systolic blood pressure is considered 120 and diastolic blood pressure is considered it is coming the 40. So yes, deduct the 140. What is pulse pressure? Pulse pressure is the systolic blood pressure minus diastolic blood pressure. Okay, so that is what you call as the pulse pressure. Here you have to minus this one 120 40 from the 120. So the answer goes here as the like 80 mm of Hg. Okay, so it's an increased pulse pressure, or you can say the widened pulse pressure will be seen in the case of the patent ductus arteriosus. Hope the thing is clear and clear to you people, right? So here is the next very important questions and concept, so related to the mass the following. Okay, so the question was very simple, related to the reflexes of the newborn, right? So here we have to reflexes of the newborn we have to compare. So first statement is the baby turn head towards the side when cheek is stroked. So which reflex is this? Yes, this is the reflex called as the rooting reflex. Okay, when you will stimuli the cheek of the baby will turn the head towards the stimuli. Okay, it feels the mother's breast is coming, I have to suck the milk now. Okay, so like the baby will feel and baby will turn the head towards the side of the stimuli. Okay, that is the rooting reflex we can say. Okay, so then the second statement, sudden extension and abduction of the limbs in response to the sudden noise. Okay, so there is sudden noise, so then the child is suddenly abducting his limbs and responding to the noise or the sudden dropout of the head. So that is the amoral reflex, right? So then comes to the third statement: baby grasps an object placed in the palm. Okay, so we are keeping the object in the palm of the baby, and the baby is grasping the object. Okay, so that is what you call as the palmar grasp reflex. Okay, so then the Babinski reflexes, that is the dorsiflexion of the great toe and panning of the finger. So this is how we have to cross match here. Okay, so the first statement here coming as a like a is 2. Okay, a is 2, then remaining like eliminate all thing. So just for the confirmation, go for the next. B is 1, yes, B is the 1, and C is 3, D is 4, right? So again the option E goes to the correct answer here, right? So this is the correct answer here, right? So the next thing is here. Yes, just previous question, like related to this Goodall sign I have told, Chadwick sign I have told, Hartman sign I have told, Piskaki sign I have told before the exam only. Okay, and Hagar sign I have told. How we have to perform the Hagar sign I have told. Okay, so these things came in the exams with concept. Okay, so that is what repeatedly I used to tell. The master nursing classes is here to discuss the concept which is there for the exams, not the questions. Okay, the questions may comes, may not comes, but the concept will remain same, and the application of the concept in your questions will get the better and best ranks in your upcoming exams, right? So here is the next question for you people, right? So the question is very simple. A 32-year-old woman, that is, she is G3 and P2 at the 32 week of the gestation, presents to the emergency department with painless bright red vaginal bleeding. Yes, clearly, forcefully, I told to you people related to the a painless vaginal bleeding and painful vaginal bleeding, a bright red vaginal bleeding and the dark red vaginal bleeding. Yes, I will show the proof. Don't worry. Okay, so she denies the abdominal pain, means there is no abdominal pain, and uterine contraction also not there, and on examination vitals are stable and the fetal heart rate is within the normal limits. So what is the likely diagnosis here? It's in case of the placenta previa. Bacho, whenever the case will comes, okay, with vaginal bleeding, okay, first thing we have to ask is the whether there is pain or painless. Yes, if it is pain, so there may be a next question, that is the we have to assess the consistency of the blood. If it is a dark red, so that is case of the abruptio placenta. A painless and pink red blood, so it's a case of the placenta previa. Clearly I have told before your exams, so the same thing which is tried in your exams. Okay, okay, here consider a painless bright red vaginal bleeding, right? So this is a case of the placenta previa. Okay, if there is a pain, if there is a pain plus dark vaginal bleeding plus a abdominal, patient will not deny the abdominal pain. Okay, there is pain will be there, so that is the abruptio placenta. So the same options with there in your exams, so the answer goes to the option B as a correct answer, right? So the next question is this one. Okay, so the JVP waveform in your prelims also one questions were there related to the dichrotic notch, right? So in the mains also the question is there. Okay, what is actually X denotes? What is actually X denotes in the JVP waveform? Right, so let me explain you the thing. The A wave here, it denotes a atrial contractions, and the C wave, this one which denotes here is the tricuspid valve into the right atrium during the early ventricular systole. Bacho, in your options there are two things which was complete what we can say confusing to you people, whether it is in the early relaxation or the late diastole. Okay, early diastole or the late diastole, like this was the question was there. So X denotes here is the, yes, the C wave is denoting that it's the early systole. Okay, it is denoting early ventricular systole. Okay, but X denotes here, what it is X denotes, it denotes a late diastole. Okay, because it happens when the tricuspid wall completely displaced in the right ventricles. So then only it happens because of the complete emptying of the right atrium into the right ventricle. Then only the X wave will arises. So that is the atrial relaxation. That is during the late diastole. The X wave denotes here. Okay, so X descends, which denotes the atrial relaxation and the downward displacement of the tricuspid wall. So in your answer in the questions, in your answer in the exams was the this is the correct answer. Okay, so this is the correct answer. This is the late diastole. So then comes to the V wave. So V wave is the passing of filling of the right atrium. Okay, it happens again due to the refilling of the right atrium. And Y descent is because of the opening of the tricuspid wall and passively in the ventricles. Okay, so this is the Y descent. So in this particular things of the JV waveform, we'll study in detail in the next upcoming classes, completely with the how actually wave will form in related to the particular JVP things. I will completely explain, so that it will create a complete clear picture in your mind. Okay, don't have to worry. So just have to subscribe to the channel and follow the channel. Whatever the content we are giving, so take it by closing the eyes, because which is striking in the exams, right? So the next very important question is here in front of you people. The question was very simple. That is, which of the following is a recognized side effect of the deferoxamine therapy in a patient with thalassemia? Okay, so there is a case of the thalassemia. So this is a hemolytic disease where the excessive hemolysis will be there. Because of the hemolysis, there is iron overload will be there. So when there is an iron overload or iron toxicity, at that point of the time you have to give the antidote, that is the diferoxamine. Okay, so here is the case of the thalassemia, which is iron overloaded. Now we have given the diferoxamine. So what is the side effect of the this diferoxamine? It's a clearly very important question which is came directly from our test series. Okay, it's an answer is the hearing loss or the visual changes will be happens due to the diferoxamine toxicity, because the diferoxamine is the ototoxic and yes, ototoxic. And one more thing, what we can say, right? So there is a changes in the what we can say, the optic nerve degeneration also. Okay, so that is the what, there is visual changes will be there, then the hearing loss also will be there. So many of you have chosen the red color urine expected. No, that is not correct answer, bacho. The hearing loss and the visual changes is the correct answer. That is due to the thalassemia hyper hemolysis, and which leads to the iron overload, where we are giving the diferoxamine means, so it causes the side effect of the hearing loss and visual changes. So this is the correct answer, right? So here is the next very important question. Which of the following is the correct hand or the wrist position during the ABG sampling? So I have told in the previous videos, like we have to keep a saline bottle below the our wrist, and we have to extend the wrist like this to access the arteries very easily. Okay, consider this one as in the saline bottle. Okay, so with practical I have told to you people. Okay, so this hand the nursing officer or the doctor is taking the ABC sample, so we have to keep like this, and we have to push this hand like this. Okay, to hyperextend, sorry, to like extend the wrist. And why we are doing like this, why we are doing like this means to, yes, to take the ABG sample from the radial artery. When we will do this extension of the wrist, so the artery will easily we can access. Okay, without any difficulty. Okay, so that is the reason I have told to keep the folded towel below the wrist or the saline bottle below the wrist to extension of the wrist. So that was the question which was striked in your exams. Okay, so the very important, that is the option B goes to the correct answer of wrist extension here, right? So the next one, which of the following is the key characteristics of the melancholic depression? Okay, so the Hippocrates called the depression as a melancholia in the before diagnosis of the depression as the term. Okay, so then the melancholia afterwards called as in the depression. So before that, the depression was called as the melancholia only by the Hippocrates. Okay, so the question may arise: who called the depression as the melancholia is the Hippocrates called the or depression as the melancholia. Okay, so melancholia is now considered as the very severe kind of the depression. So what is the key characteristics of the melancholia? So here option A is the hypomania. No, there is no any mania, not even hypomania. Okay, so option A is not correct answer. Then comes to the a severe irritability without significant sadness. There is significant sadness will be there. The patient is not irritable. Patient even won't responses to our stimuli. Okay, so we are talking in front of the patient. Simply the patient will watch to you. Okay, he will not responses to stimuli also. So patient is not irritable in the melancholia. Patient is cool, patient is calm, patient is relaxed, patient is unresponsive, and patient is having a significant sadness like this, right? So the significant sadness is present. Okay, so here in the option they have given without a significant sadness. So the answer is not option D, right? So the next very important answer goes here as the hallucination is not a classically we can't see in the melancholia, so anhedonia was the only remaining option in our exam. So the answer who all are chosen the anhedonia as a correct answer, so your answer is correct, right? So here is the next most important question in front of you people. Which of the following is the most common complication of the Kawasaki disease? Yes, almost all if people know that I have chosen the correct answer. Many time repeatedly asked a question in the test series. That is the aneurysm of the coronary artery and aneurysm of the abdominal aorta or the small and medium sized artery and large sized artery is the a dangerous and life threatening complication of the Kawasaki disease. Okay, so that is the option B goes to the correct answer here, right? So the next very important question here is that is the again assertion and reason based question. Okay, so in the last videos we have discussed the three questions, so this is the fourth question on the assertion and reason. So these are the again one more type of the question which was asked in your aims mains exams, right? So it's these are the very easy questions they have asked. Okay, so again here the one more question, the routine use of the active management of the third stage of the labor AMTS TSL. Okay, so I have told to you people clearly this is the very important and high yield content. This one will come in the exam. All the components of the active management of the third stage of the labor I have told to you people, and clearly I have told yes, the delayed card clamping is a component of the AMTSL, and early card clamping is not a component of the our AMTSL. I have clearly told you the statement was given here as like this. Okay, so the assertion here is the routine use of the active management of the third stage of the labor can significantly reduces the incidence of the postpartum hemorrhage. Yes, why? Because the two methods are there to deliver the placenta. One is the passive management, one is the active management. In the passive management, we will sit like this and we will watch for automatic delivery of the placenta after delivery of the baby, right? But in the active management of the third stage of the labor, the word active itself it is saying that we have to do some active involvement and we have to do some manuals, that is which was asked in the prelims exams, that is the controlled card traction, right? Or we can say the modified brand Andrews technique, which was asked in the main prelims exams. Yes, I have taught you people with proof. I have shown to you people, right? So we are actively involved to deliver the placenta means the duration of the delivery of the placenta will be very less. Okay, we can deliver the placenta within 5 to 10 minutes. If we are sitting relaxedly and we are allowing the placenta to deliver automatically means it will take 15 to 20 minutes, and the duration is going more means the bleeding will be more, right? So we are not doing the AMTSL means the more chance of the bleeding is there, and the statement is telling a routine AMTLS active management of the third stage of the labor significantly reduces the incidence of the postpartum hemorrhage. Yes, because the active management is completing in the less time, so it reduces the PPH, right? So the statement assertion is correct. So then comes to the reason here. So early cord clamping is an important step. Eliminate this one. So this is the wrong statement. Okay. Then comes to the options. So in the option A is telling both assertion and reason are true. No, reason is not true. So this is not our option and answer. Okay. Then comes to the option B. Yes, assertion is true. Assertion is true. Reason is not true. Then comes to the option B. Assertion and reason are true. No, not true, right? The reason is not correct explanation to assertion. No, this is reason is not a true statement only. Okay, so then it comes to the option C. The assertion is true and the reason is false. Yes, so the answer C goes to the correct answer. That is the assertion is true and the reason is false. Okay, this is the correct answer, which will goes as a correct in the your mains exams, right? So I hope the concept is clear to you people right here. Then comes to the next very important question. A 3-year child typically engages in which type of the play? So that's the parallel play. Who have chosen the correct answer as in the parallel play. So the type of the play, the sir will discuss. Okay, the pediatric sir will discuss this one. So don't Raghav sir will take a class on this one. So sir will discuss related to the art type of the play. Don't have to worry about that, right? So here's the next very important question. Which type of the restraints is most commonly used in the cleft lip surgery in infants to prevent the injury to the surgical site? So that is the elbow restraints is preferred one. So this is the correct answer, right? So the next one is here. The simple question, that is the a baby born with hemophilia A. Okay, it's a clearly a deficiency of the clotting factor number 8. Okay, that is the clotting factor number 8 deficiency. Okay, and presents to the emergency department with after the fall. Okay, and he had swelling and pain in the right knee. The patient is having the swelling and pain in the right knee. Why? Why? Because the most common site of bleeding in the hemophilia is the joint. So the classical site of hemophilia bleeding is the hemoarthrosis. What it means, sir? Hemo means blood, arthro means joint, cis means accumulation of the blood in the joint. So that is the hemoarthrosis is a site of the bleeding. Yes, the bruising will be there in the skin also. So but the hemoarthrosis is a specific site. So the answer goes here as the hemorrhagitis. And if the bruising and hemorrhagitis goes there in the options, means the priority answer goes here as the hemorrhagitis as well, right? So here the case of the hemophilia is there. It comes to the emergency department after the fall. Now the swelling is there in the knee joint. Okay, so and refuses to move. Why? Because there is swelling and pain will be there. So why the patient will move? The patient will always refuses to move. What is the most appropriate initial management? Okay, so what's the most appropriate initial management? So here the hemophilia A case is there, means the deficiency of the clotting factor 8 is there. Just replace it, and the patient is having the hemorrhagitis, stable the joint first. Okay, the option apply the heat. You are applying the heat means it increases the bleeding. Never ever apply the heat at the site of the bleeding, because heat will dilate the blood vessel. If it's normal blood vessel, after heat the blood vessel become like this and the blood will easily comes out. Okay, so don't apply heat at the site of the bleeding, because the heat increases the bleeding. Okay, so then comes to the next. Okay, so the option B, begin physiotherapy to restore movement. अरे बच्चों, joint में blood है. In the joint, there is then the blood accumulation, and you are sending the patient to the physiotherapist, and the physiotherapist will move the joint like this, like this. Okay, so there is chance of damage at the site of this joint is there. So don't recommend for the physiotherapy as of now. So then I am eliminating the option B here. Then comes to the option C, administer an intravenous factor number 8. Yes, and immobilize the joint. So this was the correct answer. You people have to choose in the exams. Okay, so this is the correct answer, right? So hope the concept and thing is very much clear to you people. So hope it is clear, right? So answer goes to the option C as the correct answer. I hope it is clear. Then here is the next most important question. So what is Nischay test kit primarily used for? repeatedly asked question in the our sure selection test series. Okay, so the Nischay test is used to go for the urine pregnancy test, updated trending question. So we will never ever miss like these questions, right? So the answer goes to the B. So it's the correct answer, right? So here the next very important question: what does the term paradoxical effect? The question from the basic pharmacology: paradoxical effect means, yes, I am giving a PCM to decrease temperature to normal. Okay, here I am giving the PCM, it increasing the temperature, means it is giving a exact opposite reactions. So that is what you call as in the paradoxical effect of the drug. Okay, so let me search the answer. Option A, the drug has no effect. It's not an answer. Option B, the drug has causes the allergic reaction. No. Option C, the drug produces an effect opposite to what it is expected. Yes. So here we are giving the PCM to decrease the fever, but the PCM is increasing the temperature again, means that's the opposite reaction of the what we have expected. So this goes to the correct answer, right? So then comes to the option D, the drug enhances its expected effect. So it's not a correct answer. So option C goes to the correct answer here. Okay, so hope it is completely clear to you people, right? Okay, so here is the next most important question. Yes, the question is very simple. Which of the following medication should not be diluted with dextrose? The practical based question, the practice based question. So daily we will do this particular thing, and we will remember this thing before going to one drug. That's the drug we call as the phenytoin. Never ever mix with the dextrose. If by mistakenly you are mixing this one with the dextrose, means it creates the precipitates. Okay, it creates the precipitates. Okay, so that's the reason never ever mix the dextrose with the phenytoin, because it creates the precipitates, right? So hope it's clear. The answer is the option B, right? So here's the next very important question related to the match the following. Okay, so the thing is very much clear here, and we have matched it already. So related to the JSY, Janani Suraksha Yojana, related to the Poshan Abhiyan, related to Lakshya. Already we have discussed in the last video of the prelims crash course related to the Lakshya. I have told the logo of the Lakshya, the purpose of the Lakshya, everything, and PMSMS. Okay, so that is the PMSMA. Okay, so JSY means that is the Janani Suraksha Yojana. Janani means mother, matru, mother. Okay, we are doing the Janani also. Okay, it's not JSSY. So it's in JSY. Okay, so that is the Janani Suraksha Yojana. Okay, that means we are worried about the mother right here. So this JSY now converted into JSSY, and it's again updated to another program. I will tell in the next question, next video session. Okay, don't worry about that one. Okay, so JSY is the Janani Suraksha Yojana. So here it's in scheme for the institutional deliveries to reduce the maternal and neonatal mortality. Okay, so here main focus is to reduce the maternal mortality. Okay, so this was the comparison we used to do. Then the portion is the, yes, the word itself telling it's in the portion. Okay, it's in the nutritional program. Okay, so the program to improve the nutritional outcome of the pregnant woman and lactating woman and children under 6 years. That is the Poshan Abhiyan. Remember, very important there in the Lakshya. It's on labor quality, labor room quality output index, what we can say the program. Okay, so the Lakshya is the initiative to improve the quality of the maternal and newborn care in a labor rooms and maternity wards. So that's the Lakshya. Everything we have discussed already on the Lakshya. Then the Pradhan Mantri Surakshit Matritva Abhiyan. Okay, here it is the aim to provide the quality antenatal care to the pregnant woman. So this was we used to compare the thing, and we used to select the correct options in the exam. So I didn't get the actual options, so I have not kept the options. Okay, so just these are the important things which came in the mains. So I'm telling to you people, right? So here's the next most important question. That is, a pregnant woman presents with a hemoglobin of the 8 gram per deciliter of the iron and okay, so 8 gram per deciliter, and the iron and folic acid supplementation is prescribed as a part of the heart treatment. Under which national nutritional supplemental program we have to provide this one? Okay, where there is a very simple question. So here's the a pregnant woman is there, her hemoglobin is only 8 gram per deciliter. Now she visited the PHC, CHC or anywhere. So there they have given the iron and folic acid supplementation. So under which national health program we used to give this supplementation? Okay, so in the first video I told there are the total 3 to 4 questions on the Anemia Mukta Bharat program, one program only. Okay, so the questions on the deworming day celebration, yes, that is the biannual program. The deworming is a part of the Anemia Mukta Bharat program, right? So then most importantly, the questions were there on the 6 into 6 into 6 strategy, and in the prelims the questions are there on the folic acid and iron doses. Okay, again in the mains, yes, the Anemia Mukta Bharat program striked. So in detail, in complete, I have explained the Anemia Mukta Bharat program in the important OBG videos. Please do check out once. Okay, so the answer is Anemia Mukta Bharat program. Under this program we have to give the iron and folic acid to the pregnant woman to improve her HB. Okay, so here is the next important question. So that is the 45-year patient with end-stage renal disease and diagnosed with the schizophrenia. The schizophrenia patient with end-stage renal disease, he is refusing the dialysis, and the patient is stating that God will heal me. Okay, so the patient has a history of the delusion also and religious beliefs also associated with their condition, and the nurse needs to determine the next appropriate action. Okay, so what is the most appropriate nursing action by the for this particular patient? Okay, the schizophrenia patient is there. For this patient, he is in the end stage renal disease. In the end stage renal disease, we have to go for the renal replacement therapy. So the primary is the go for the dialysis plus kidney transplantation plan we have to do in the end stage renal disease. Okay, so that is the renal replacement therapy. If the renal replacement therapy is failed, the patient is failed. Okay, so now the patient is ESDR stage, that is the end stage renal disease. Okay, ESRD stage, and the patient is having the schizophrenia, and the patient is refusing the dialysis. He is telling, I don't want dialysis, and he is making a statement that I don't need any treatment, the God will heal me and God will help me. Okay, so what is the next appropriate step? So option A, respect the patient wish and stop the discussing dialysis. No, the patient is having no any proper wishes and no any proper purposes, because it is a no case of the schizophrenia. Okay, so this is the not correct answer. Then comes to the option B, involve a psychiatrist or a mental health professional to assess the patient's capacity to make decision. Yes, then the option C, immediately call to the family and inform them and refuses without the discussing the patient. No, this is not a proper statement, right? So option D, force the patient. No, we can't force the patient. So answer B goes to the correct answer. Here involve the psychiatrist or the mental health professional to assess the patient's capacity to make decision. So this goes to the correct answer. Okay, so all are chosen this one. So your rank are very good in the mains, right? So here is the next most important question. Behavioral, the therapy questions asked in the exams, that is to treat the borderline personality disorder. Okay, which therapy is considered as the most effective for treating the borderline personality disorder? So all personality disorder we have discussed last time in the last video of the one shot on the prelims. Okay, in that one I have discussed on the borderline personality disorder. Here the patient is having the problem to make the relationship. Always the patient will stand in the border. Okay, so not in the left side, not in the right side, not in the positive way, not in the negative way, always in the middle. The patient will be in the always in the confusion and dilemma state. Okay, to make the relationship, to make the judgment, to make the calculation, to make the particular day-to-day easy tasks. Okay, the patient always remains in the borderline, so that is the borderline personality disorder. So in order to make a patient to support to make the relationship, so we have to go for the one important therapy, that is the dialectal, means borderline means here not left not right, here it's in dialectal means whether it may go to the right, whether it may come to the left. Okay, so the dialectal behavioral therapy is the specific and best therapy we used to specifically used in the borderline personality disorder. So hope it is the clear to you people, right? There is the dialectal behavioral therapy used in the borderline personality disorder. So all are chosen the option B as a correct answer in the exams. That is your answer is very much correct. Okay, so the next very important question is, which of the following is the biological method used to control the mosquito breeding? Okay, so in your areas there is then the hump in the wall, or we can say the break in the road. Okay, so where the water is getting stagnating and the mosquitoes are breeding here. Okay, so in order to destroy this all thing, so we used to use the many methods, okay, like chemical methods, physical methods, biological methods. So in the chemical methods we used to use the chemicals like DDT powder we will throw in this water. Okay, so that is the chemical method. Okay, so in the physical methods we used to use the full sleeve what we can say shirt, and we used to use the mosquito net to protect from the mosquito. So that's a lot of physical methods. And the biological methods are, we used to use the fish, that's the Gambusia aphenicus. So Gambusia aphenis fish, this Gambusia aphenis fish which destroys the mosquito breeding. So here we have to leave this fish in the what we can say the stagnant water, so it will destroy the mosquito breeding. So the biological method the examiner asked, so our answer goes to the Gambusia aphenis fish is the correct answer, right? So here's the next again very important question, which of the following service is not provided under the Janani Shishu Suraksha Yojana? That is the GSSY scheme. Under this GSSY scheme, which of the following services is not provided? Okay, so the option is the cashless pre-delivery. Yes, the ambulance will come to your home. It will take the patient to the hospital, and after the delivery, so it will leave to the hospital. There is no any cash involvement, and in the hospital, whether it may be a normal vaginal delivery, whether it may be a cesarean section, whatever it may be, the hospital itself it will arranges for everything, and they will do the things without taking any single rupees. Okay, so that is the cashless free delivery. Yes, it's a cashless free delivery. And free drug and diagnostics to the pregnant women. Yes, of course, free drug and diagnostics so we have to give. Then free transport from the home to hospital and hospital to back home. Okay, yes, so this is also will do, this is also will do. Free taxi services will not provide us. Okay, so this is not a correct answer. Okay, so in the question also they have asked that is not provided under the SSY. So option D will not provide. Okay, so the correct answer goes here is the option D. Free taxi services in the rural areas are not provided under the GSSY scheme. Okay, hope it is clear. Hope it is clear to you people, right? Don't worry. I will share the entire PDF with the correct answers in all the master nursing classes YouTube channel, sorry, in the Telegram channel and in the WhatsApp channel. Okay, do join there. All are not a part of our WhatsApp group. The link is there in the description box, where we are sharing the daily notes, night note, morning dose, all important PDFs, all important information, updates, class related updates, class timings, everything. So yes, if you are not a part of the WhatsApp group, please do join the WhatsApp group because it's for your sake, right? So the next very important question is, which of the following option correctly list all the four strategies of strategic pillars of the National Tuberculosis Elimination Program? So that is the correct answer is the yes. Yes, correct answer is yes. Do comment the correct answer in the comment box. This is for your assignment. Don't go for Google. Yes, that is also will tells the correct answer. Just I want the correct answer for this question. Okay. So here is the last question. That is the ETO. Actually, the question was came ulta here. So this is the question from the our test series. Okay. So heat and moisture sensitive medical equipment like endoscope will be sterilized by the which kind of the what we can say sterilization technique was the question. Okay, so here the endoscope we will use for the high level of the sterilization where 2% of the glutaraldehyde, okay, 2% of the glutaraldehyde we used to use for the sterilization of the endoscope, but it was not there in the option. So the answer goes there as the ITO. Okay, so that is the ethylene oxidase sterilization is primarily used for the heat and moisture sensitive medical equipments like endoscope. The first priority answer goes to the 2% of glutaraldehyde, but this was not there in the option. So then ETO, ethylene oxidase, will goes to the correct answer. Okay, so these are the again 40 to 50 questions with a clear, complete rationale and options, which was there in mains exams. So these are the total questions what I got. Like previous video we have got discussed around 56 to 60 questions, and this is around 45 to 50 questions. So 110 to 120 questions we have discussed, and remaining questions if I got means I will cover in the next upcoming videos. I will take one by one questions, don't have to worry about that one. And still any questions, if you are having doubts on your mains question papers, so please do comment in the comment box. So this was the question, these are the options which was came, and what was the answer you just asked. I will try to comment to your answer as well. Okay, so I hope the thing is clear to everyone. And if you want to prepare for the upcoming Norcet 9, so we are having the beautiful plan for you people. That is the Norcet 9 Navagraha test series. Here you are getting the live test series, extra practice papers. Okay, so weekly booster class, a chart box support to clear your doubts for till your Norcet 9 mains exams. Okay, entire thing we will provide under this particular single package. That is the very important Norcet 9 Navagraha test series package. If you want to become a part of this test series, so please do download the Master Nursing Classes app. The app link is given in the description box, in the comment box as well. And if you are still not a part of our free WhatsApp groups or the WhatsApp channel or the Telegram channel, I have given the link in the description box. You can join directly from there. So thank you for watching the video completely till the end, and hope for the best. Hope everyone will get your designated aims. Whoever got the good result. So the further process will update in our YouTube channel. Stay connected, stay motivated. So तब तक के लिए जय हिंद, जय भारत, take care, love you all, bye.